My name is Dr. Saad. I'm a plastic surgeon at the Institute for Advanced Reconstruction and the Plastic Surgery Center in New Jersey. Core muscle injury, it's actually known by many different names. Core muscle injury, sports hernia is probably the most popular name. Athletic pubalgia is another one. But essentially all that's happened is that the muscles of the core, which are the rectus abdominis or the stomach six-pack muscles, and the adductors, which are the groin muscles of the thigh, have been injured. And just like you can injure your hamstring or your bicep, that injury causes pain. Typically, core muscle injuries happens when you're doing physical activity. It doesn't mean you have to be a professional athlete. So any physical activity where you activate your core, things like bull riding and pitching were the old standards because they involve a lot of core use. But anyone that uses their core, overuses it, or uses it too much, can develop injury of it. The typical symptom of core muscle injury is pain, either at the bottom of the stomach or in the groin, that happens when you activate your core. So whenever you're doing something physical, you feel that pain. A lot of times the pain will go away if you're not doing anything super physical. Some patients will get better with rest, and some, as soon as they start doing something physical again, will develop this pain. The diagnosis for core muscle injury is basically done by physical exam. We have you do a sit-up and we feel your abdomen, see if you have pain. We have you move your leg and see if you have pain there. A lot of patients do get an MRI, but the MRI is only helpful if the injury just happened or if you have such a severe injury that the muscle actually detaches from the bone. The conservative treatment option for core muscle injury is basically steroid injections, therapy, and rest. Everyone should try rest and therapy before they turn to surgery. And rest means you give it a good 2 to 3 months off of any real strenuous physical activity and try some physical therapy. The surgical option is basically repair of the muscle injury. So if the six-pack muscle has been injured, we try and repair it. If the groin muscle has been injured, we try and repair it. And this is typically done with sutures, and sometimes we use absorbable mesh to help as well. Surgery day, you'll come to the surgery center. Typically, you go home the same day from that type of surgery. We make a small incision in the groin. We find the injury to the muscle of the six-pack. We put some sutures to repair it. We put a support mesh in over that. And then if the thigh muscles are injured, we make an incision over the thigh. And we repair those muscles, or we sometimes have to lengthen them because they become too tight. After that, go on the same day. Typically the first week or two is a fair amount of discomfort, but after that, the patient really starts to feel better. One of the most important things about core muscle surgery is the rehabilitation part after surgery. It's almost more important to have proper rehab as it is to do the surgery. After the surgery, you won't be able to do anything very physical for about 6 weeks. You will be able to do activities of daily living, such as driving, walking upstairs, but you can't do anything super physical like going to the gym or running. After 6 weeks go by, then we'll examine you, and if you're feeling okay, we'll start you on a physical therapy protocol, and that lasts another 6 weeks. So typically it's about 3 months before the patient is able to resume all normal activity. The reasoning behind this is that once the muscle is injured, we need scar tissue to form in order to allow the muscle to be repaired. Scar tissue formation takes about 6 weeks to really be established, and that's why we don't let you do much for the first 6 weeks or so. Outcome after core muscle injury surgery is very good. About 90% of patients will be able to resume their prior activity, and 80% will be without pain. My hope for the future is that core muscle injury becomes more well known by non-surgeons so that they can refer the patients to the right spot. Most of my patients have been looking for someone to treat them for a very long time.